Good evening, everyone. This is Emlyn. I'm with Brave Communities, and thank you so much for being here on a chilly Tuesday evening in Austin, Texas. Although I just talked to my sister outside of Cleveland, and she's like, it's 20 degrees. I'm like, okay, I have nothing to complain about. So I just want to let you know we are also on Facebook Live. So if you want to share this, you can also watch it on Facebook, or you can also like share it to your network. So those that don't have the Zoom link, or they are more shy to like come on board, they can also watch it online. So I just give everybody a second to kind of share that, including myself. And so we will begin this conversation shortly. And we actually always love to know like where people are from and where. So if you want to drop it in the chat board, we also have a little poll that we have. But if you want to just drop in, like now that we're virtual, we are like from all different parts of the Austin or Central Texas or even the States. So feel free to drop in where you're from. Hi, Crystal. Oh, I love these names popping up. Shane, hi. And Jamie. Snickers there? Shing's on my lap. She's probably excited that I'm here this evening because it's cold in the room. She's my little personal heater. Hi, Jamie. Oh. Well, wonderful. We will get started. We have a wonderful group of speakers tonight. I would call them community champions because everyone is doing such amazing things. And so again, welcome. My name is Emlyn. I'm the founder of Brave Communities, and BRAVE is an acronym for Building Relationships, Awareness, Voices, and Engagement. And I founded in 2016 to really have these conversations, to understand our similarities and share our differences, to be able to, understand systemic injustices, and then how do we try to work together and do an individual reflection to a more collective collaboration of transformation. And so I'm really excited for tonight's conversation. We're going to be talking about education and representation. And when I say education, it's not just in the classroom, it's also like our materials and resources that we have, like books and media and things like that. So how do we like learn and even ourselves, our conversations, like how do we have diverse conversations and talk to different people? And so I just want to introduce our panelists. I'll have them do kind of a self-introduction. So I'm just kind of going to go down in alpha order of last name. So if you want to start off with Sharon.
Hi, I'm Sharon Cohan. I'm the founder and executive director of Together Austin. We are a 501c3 nonprofit that started little less than a year ago. We're pandemic born, and our one and only major project right now is Vax Together Austin. We're a vaccine equity project. We bring the vaccine to underserved communities and promote vaccine awareness, education, testing, and just trying to increase vaccination rates here. So happy to be here. Hi, everyone.
Thanks, Sharon. And Michelle?
Good evening, everyone. I'm Michelle Hudson Crawford, and I'm the K-12 Director of Education at United Way for Greater Austin. I have the pleasure of working with several community organizations and individuals in the community as well, around our first initiative, if you will, which is the Greater Austin Reading Coalition. So I'm so excited to be here this evening. Thank you.
Wonderful. Thank you so much. And Miss Allie?
Hi, I'm Allie Owens, and I'm currently a freshman at Anderson High School in Austin, Texas. And I'm also a Brave ambassador, which means I get the opportunity to work with Brave and spread awareness on issues and help a variety of different communities. And yeah, over the last couple years, I've experienced online and in-person school. During COVID. So I think it is really important to talk about vaccination and all that good stuff. And so, yeah, I'm really excited to be here.
Thank you so much. Thais?
Hi, I'm Thais Perkins. I own Reverie Books, which is a brand new independent bookstore in South Austin dedicated to representing underrepresented voices. And I'll tell you a lot more about that later, but I'm so excited to be here. I'm one of those really annoying people who will sit you down and draw models of vaccines and viruses and what they are and how they work. If you get me started on it, I used to teach biology. So this is near and dear to my heart. Thanks so much.
Nice. I didn't know you taught biology. Wow, you're like
Yeah, at a university.
that's great. And she's so artistic and talented. So yeah, it's like another science and art. That's amazing. Rati?
Hi, everyone. My name is Arthi Singh. I'm a trustee for Austin ISD. I want to give a huge thank you to Emlyn for bringing us all together. I am so excited, mostly that we have a student here from our school district. Allie, I can't wait to hear what you have to say. And I will just take this moment to just acknowledge how wonderful it is that we have so many people that have risen up to the challenge of this pandemic from all different sectors. And I'm so glad to see so many different sectors represented here today. And I'm also going to make a plug for if anybody wants to be a substitute teacher, if you've ever dreamed to be a substitute teacher in Austin ISD or really any Central Texas school district, now is the time. We need you very badly. Thank you.
Thanks for RT. I heard that, and then actually I was going to invite some friends that are teachers and are teachers or administrators, and I just know that they're slammed. So I'm like, okay, well, just things outside of the classroom too, and let them have an evening alone. So and Matt, last but not least, Matt.
Hello, I'm Matt Williams. I am the Central Texas Clinic Lead. I pretty much put all the clinics together for Central Texas.
Wonderful. Thank you so much for all that you're doing, everybody, what everyone is doing. So just a little housekeeping. We've been hosting these events for like 5-6 years monthly in person. And so even though we've all kind of understand the Zoom protocol, I just wanted to remind everybody that we wanted to have it more as a meeting versus a webinar, just so that we could see everybody's faces and still be in community. So if we just ask that everybody mutes yourselves unless you're speaking, and we certainly welcome questions. So if you're on Zoom, feel free to drop any questions you have in the chat board. If you feel more comfortable just to like have it a private message, you can message me, or else there's also, I think the Brave Communities one, and Melanie's managing that. So we can always, ask the questions to the panelists. If you're on Facebook, we have someone moderating that chat board too. So feel free to drop any questions you may have on Facebook, and then we will be able to prompt the panelists. We do have a poll. We always love knowing where people are coming from and where they're at. And because we really embrace multi-generational and multicultural connections, we just have this question of like age and race and what county you live in, just so that we can get to know each other a little bit better. So feel free, if you're comfortable, to fill this out. We have this little poll that we just dropped here into Zoom for a little audience participation, and then also one on Facebook. And so really, if audience members, we appreciate you too, because this is what builds community, is really having all of our voices and heard, and listening and sharing our stories. So with further ado, I just want to, get started off with our conversation. And I'm going to fill this poll out because it's in my face right now. So let me get this done. So As we lead into MLK's birthday, which is January 15th on Saturday, and then also his observance day, which is the national holiday on the 17th, which is Monday, I just wanted to start off this evening's discussion with a quote from MLK. And so it says, education must enable one to sift and weigh evidence, to discern the true from the false, the real from the unreal, and the facts from the fiction. And again, that's from Reverend Dr. Martin Luther King. And so with that, I kind of want to like throw it out there, kind of popcorn style to the panelists of what does this quote mean to you, especially as we're almost like 2 years in with the global pandemic. And so kind of like resonating with that quote, what does that mean to you individually, as a professional, as a community member? And so if anyone wants to, feel free to like popcorn, that you can just like unmute yourselves and then we'll spotlight you.
Well, I guess I'll start. Let's stop the awkward silence. So I am just, I have so many things running through my mind right now. The obvious one is, sifting through the evidence around vaccines and how effective they are, around masks and how effective they are, and how politics has kind of warped a lot of that dialogue. And I'm just super proud of our district, of our superintendent and our trustees, and really our community for asking and actually demanding that we take safety measures. And it just makes me just super proud to be able to be part of this community that is asking for masks, asking for vaccinations. When the vaccines first came out, AISD was able to get hundreds of our staff vaccinated last January, and that was amazing. But the other thing I want to mention is a little bit more nuanced, because this idea of discerning and sifting, we're constantly having to do that. Every decision is so monumental, and we've got to weigh so many different things. Even the decision for offering virtual learning last semester, that was huge, because we had the situation where the state was saying that they were not going to fund our school district for virtual learning, and we could have we did lose millions and millions of dollars, but we had to sort of weigh the impact of, sending unvaccinated students to school. Because remember, last fall, our kids who were 12 and under, or who were under 12 years old, were not vaccinated. And they didn't, a lot of families have, health there's people with health problems or, other issues that concern them. And we were just like, what, we've just got to make this a priority and take a risk and offer virtual learning. We had about almost 3,000 families take advantage of that. And they were able to do that. So, luckily the state is going to reimburse us for a small part of that. But when I see this idea of like discerning and sifting and weighing evidence, it was like, do we risk lives, by sending kids to school or not? And we really had to look at the science and come to a decision that was a tough one. But I'm glad we did it. And I'm sure many of you on this panel have had to make similar decisions in your organizations.
If I may, I would say, and really I go straight to the place of having been a biology teacher, unfortunately, instead of the bookstore part. But it's clear to me, and has always been clear in this debate around vaccines, because this is not the first time we've had a debate around vaccines, that the lack of access to quality education in biology for a lot of people has made it harder to wade through what is sometimes really conflicting guidance, right? From the federal government in particular. It's not that people don't have some access to it, but they just don't have enough. And if we had clear guidance, it would be one thing. But unfortunately, that ball has been punted to the states, and then to the locals, and then to the school districts, and then to individual parents to somehow wade through it all on their own. So a quality education is fundamental to being a good citizen. And that's not just humanities educations, but scientific education is obviously really important to creating citizens that can function.
I would add to that. I was thinking about that when I was thinking about this question. I'm a proud Longhorn. I went to UT Austin and graduated forever ago. And one of the required courses in my program, I was Plan 2 honors, was called Problems and Politics in Biology. And at the time when I registered for this course, I couldn't figure out how politics could have anything to do with biology. But the entire course, it was a science for non-science majors course. So you had two choices in Plan 2. You could take the biology that was for pre-med and for the natural sciences, or you could take this this non-major class. So that's what I took. And the entire course was actually about discerning scientific literature studies, understanding where these studies come from, who funds them, what is a peer review, which are the journals and the, types of, newspapers and, news. And, when you see an article, when you hear a news segment, how do you look at that? How do you, decide whether that was valuable information? Was it factual or not? And I think that when I think back on my college education, that was probably one of the best classes that I took, especially given the last 2 years and the information overload and just, is it true? I think maybe in very few other times in history have we, the public, ever had to absorb so much information and have to wonder every second, is that true? Is that fact checked? Whose truth is this? So I think that I would add to quality science education, quality education in just understanding where do these studies come from? How do you read them? How do you interpret them? And how do you know if it's true? And personally, I do a gut check first. And then I start trying to figure out where it came from. And sometimes you can scroll all the way down to that tiny print at the bottom and see who paid for that study. Was it peer reviewed? Was it independent? And you can click on, Google the name you see at the bottom. If they're a doctor, but they're a dermatologist and they're coming out with some really strong opinion on epidemiology, you might give that a little bit of pause, just like I wouldn't want to, a dermatologist. I'm not trying to pick on dermatology, guys, but I wouldn't want a dermatologist operating on my heart. I probably want an epidemiologist or a disease specialist. I'm going to listen to that professional more than someone who only focuses on a very tiny part of the body, or maybe they are a doctor, but they're not a medical doctor. So I think that just really looking at who's speaking and where the information is coming from is important, and that we should be teaching that to our students so that they can discern that information too.
I wanted to say, Sharon, I actually created a class like that I taught in Southeastern Louisiana because they were having such a hard time wading through what was real and what was not real, and which places and this was pre-social media. So we didn't even have that issue. So we would read opinion papers back and forth. And what the students said is that the most important thing about the class is that they could be wrong safely, that they could be wrong and there wouldn't be a pile-on. There would be discussion, and it was really very student-led. To that end, of course, in the bookstore, in Reverie Books, we carry specifically the list of banned books that Representative Krause put out. We put a discount on those because, to restrict points of view and restrict book availability just flies in the face of everything we're trying to accomplish.
That's wonderful. And I think that brings it to also what is truth? Well, I think that we often use truth and experience interchangeably, and they're not interchangeable. What I think there is a difference between, what is your experience, and then also, or what is someone's personal truth, and I think that's important to explore as well.
And of course, it's evolving, right? So books like the 1619 Project are showing us an evolving picture of American history. And people can be uncomfortable with the idea that the truth is something that can change. We are becoming more sophisticated in our ability to understand things. Science changes, our view of history changes, the more that we learn about it.
And Allie, I might ask you, as a student, and a very like well-read, and you have such an amazing, powerful mind, and I love when you use your voice with it. How do you, what are your thoughts when you're in classrooms and when at your school? And I remember like your Brave Makers video was like so powerful. Can you share a little bit more of like your insights of as a student, and being in classrooms and even outside the classrooms, and when you get so much information, either on social media, and then also like the information from your schools and your teachers?
Yes. Education was definitely like around the pandemic the biggest change for me, and the biggest transition, because online learning required me to organize differently and toggle my learning style to kind of adapt to the new changes that were happening. But overall, when I would compare the two and like look outside and see like how fast this was spreading, there really was no comparison as to like what my choice was. Obviously, online school's not my like first option, because I like to be hands-on in the classroom. I'm more of a visual learner as well, so that helps me. But especially like where we are right now in the classroom, it is really scary, like walking in there every day and seeing like a third of my class gone because of COVID. Like ever since we got back from break last week, it has been really bad, like way worse than I've seen like the years before. But when we get all this like information from social media, especially because I'm a teenager, even I have to admit, so I am on there a lot, but and that's where I'm getting most of my information. But I've always made sure to, compare that to what I'm getting on the news and like doing research, which sadly some people my age don't do that, which makes them ignorant to the fact that it is happening with like they're not really seeing what's happening. And in school you get a bunch of different opinions, so there are people who feel one way about it and there are people who feel another way about it. But personally, I've always just gone off of like what I'm seeing like happening in real life. So, and if I see a problem, I want to know solutions. So if people are telling me get vaccinated, wear your mask, I think I will do my part to do all of those things in order to stop this spread and be able for us to get back to normal as soon as possible. But yes, definitely online school, even though it was like hard, I would like, especially like right now, I'm glad we did it because I do think it helped a lot, because in school is better, but COVID spreads really fast because some kids aren't good about, practicing social distancing and wearing their masks. So I just think it is important to do those things and make sure like the information you're getting is helping you be productive in solving the problem.
Thank you for that. And Michelle, do you have any insights, especially like your reflections on that quote? I know you're a public servant with what you do at United Way, so just kind of want to hear what your thoughts are with that quote.
Yeah, I was actually looking at that whole piece from Martin, and I want to add a little bit to that. He said, we must remember that intelligence is not enough. Intelligence plus character, that is a goal of true education. And over the last, rounded up 2 years now, that's been a struggle with a lot of the systems. And it's always been a struggle with many of our systems, but with our media, with social media, just like Ali said, our children are on these social platforms. They're looking at these things. So I'm just, I'm really proud that I have been at a work home where our leadership has, they've stood their ground and they follow the science, they use logic, and they just mandated that, that we follow the precautions. So I don't know, just sitting here listening to everyone and thinking about that and hoping that, we really come out on the right side of things. I'm an optimistic person. And so I just, do believe that we just continue this, continue to push for what's right, that, we're going to budge that needle just a little bit. Yeah.
Thank you for that. And Matt, do you have any thoughts, as I'm sure you encounter like so much of the community as working at Walgreens, like what your thoughts are personally and professionally with this quote?
What I hear when I read Dr. King's quote is I hear a man who spent a lifetime trying to get two different parties to communicate. That's what I hear from that quote right off the bat. And all of us right now, we're here because we're like-minded. We want to see the world heal. We want to see the vaccine rate to go up. We want to see COVID go away. But just like you said, that's not always the case. There's a lot of people that don't know where to trust. They don't know where to get their information. And Dr. King here, I can see him starting a conversation with somebody, and it might go something like this. It might go, somebody approaches him or somebody approaches any of us and says, I don't trust the vaccine for XYZ reason, right? And then you might say something back to them like, well, who do you trust? And then you start a conversation about who do you trust? And then you ask, okay, so you trust them, so who do they trust? And then once you get that dialogue going, then it opens up the door to find compromise and to figure out what the fear is and what the misinformation is, and to help them or guide them to maybe a different result, and just help them, guide them along the way. And you get a friend on the way too, because once you figure out their challenges, they're your friend, and just move forward. So it's something in that category. That's what that sparks for me.
That's great. Yep, it is true, right? I'm going to drop it in the chat board. Love is greater than fear. If we can actually have dialogue and get to know other people, regardless of our differences, and get to see the humanity in other people, but also share the facts that comes from our heart. It changes the fear in people, and then in our society and our communities. So, with and you kind of like talked about that, Matt, and you kind of like are transitioning into like, how do we respectfully, when it comes to like being socially responsible, to getting vaccinated and wearing masks, like some people, there are like immunocompromised people that, aren't able to, or like, how do we respectfully understand where we come from, and also like addressing the social responsibility to make sure that our families and our communities are safe? Does anyone have any, we kind of touched about that, but does anyone want to share any more insight on that?
So I have two kids, and now they're 11 and 16. One of them has COVID right now, although they are vaccinated. I participated in the vaccine trial myself, in the Moderna trial. But when they were very little, the friends that I had were not in favor of vaccinating their children. And I had to wrestle with not wanting to push that. So I was afraid. I was afraid to push it with my friends because I didn't want to endanger my friendship. Because as adamantly as I felt that vaccines were important and safe and trustworthy, they just as adamantly felt that they were not, and so I would kind of dance around it. And I eventually got so frustrated with myself and decided that I wasn't ever going to back down from that conversation again. And my kids got really upset with me. Remember that time March 2 years ago when everything shut down and we thought it was going to be like 2 weeks? So they thought they had a 2-week vacation. And my response to this challenge was to create virus school. And to get their friends in on it. And I had 2 classes, one for my daughter and one for my son's demographic, right? And we had these Zoom meetings. They had to make models and like read books about viruses. And there's a very embarrassing experience with having my daughter's class read and the band played on. which I remembered as quite safe, and it's really a little touchy. So my response was just to hit it incredibly hard. And as a result, they're able to take in the scientific information as we move forward through the pandemic. So they were mad at me. They dragged their feet. I'm glad we did it. But I have a lot of sensitivity for people who shy away from those hard conversations, because there is a social pressure, there to not, to just go along with it. I'd be interested to hear how the other panelists, and particularly you, Allie, experience that when you're talking to your friends and neighbors.
I try to practice like actively being open-minded and being less worried about being right all the time. So I ask questions and try to be a good listener, suspend judgment until I know all of the facts. And I've kind of done that all throughout my life. So when COVID happened, I kind of like applied it to that as well. So instead, because I've seen a lot of people, especially friends and people at school, be persuaded by misinformation very easily. So I kind of try to listen to like what everyone's saying. And then once I find a common denominator in that, I'm like, oh, like this might be the right thing to go off of, or, the right rules to go off of. And also through this whole thing, like this whole pandemic, people have been saying the same thing: wear your mask, stay distance from people, get vaccinated. So since those are the common things, I do try to and do practice those like all the time. But when like comes to disagreeing with someone about an opinion, it does get harder, because responsibility around hard issues like being vaccinated, it can become like a heated conversation amongst friends, and then it can turn into a political issue, which has happened multiple times at school, and everything. And unfortunately, not everyone is as good at holding space for others' opinions. So that has been difficult. But simply, I try to hold space for others, and if I don't agree with their views or point of view on a big deal like this, like COVID, I just think it's important to realize that this issue is affecting people outside their own home and will continue to affect people that isn't just themselves. So you have to not, like, you really can't be selfish in a situation like this, and you have to take it very seriously. So for me, getting vaccinated was something that wasn't an option. Like, it was like, obviously, like, why, like, if here's this thing that can help us get rid of this, or slow the spread, so obviously I'm going to do it. But getting vaccinated is definitely something that people should be doing to protect those around them and anyone they may come in contact with, because you don't know everybody's background. Someone you come in contact with could be immunocompromised. My parents are. So I have been really, really cautious since the beginning of this, because I know how serious it is, especially grandparents. I had a grandparent pass away from this. So it's just, there's so many things why it's personal for me, but even if it wasn't, I still would do this, because this could happen to somebody else as well. So yes.
I saw that come up in the chat. This is the bravest thing I've seen the brave youth do. I'm just so impressed with your willingness to take these books and this information and move into your own communities and have those difficult conversations. It's a very brave thing to do.
Thank you.
It really is. I think one of my least favorite phrases of maybe 2020 to 2021-ish is "you do you." I really dislike "you do you." I think that there are some contexts that it's appropriate, and then I think it mostly just completely disregards social responsibility. And "you do you" with respect to the pandemic is incredibly unfair, because we can't just do ourselves, because we can, seriously impact the health of other people, even if we don't mean to. And I think that, unfortunately, information in the beginning of the pandemic was so confusing. And there was so much misinformation, and the information was coming in bits and pieces, and there's so many things we didn't know, and masking especially. The information around it in the beginning was just so terrible. And so I think that a lot of people I think there's several different things going on. There's people who truly believe that they're not wearing their mask and it's really not harming anyone because they just don't believe in COVID for whatever reason. There's also people who get it, but just feel like they're just not going to do it. It's infringing on their personal freedoms and they're just not going to do it. I think there's a lot of things going on, but I have a very hard time personally when I see somebody who's deliberately not wearing a mask and coughing on someone, or just, they're clearly ill and they're not masked and they're doing that. And I mean, Matt knows, I will tell just about anybody at one of our clinics, I need for you to put your mask on, please. Like, please put it on over your mouth and nose. And, Matt said something great. I can't remember. It was during a time when being fully vaccinated really did mean you weren't spreading COVID, and there was that time where you were fully vaccinated and it was before there was really a chance you're going to spread it. And he said something like, I'm going to wear my mask because it makes other people feel comfortable and safe. So, and I think that I thought about that a lot. Like, that's what everyone should be doing. And if everyone were doing that, regardless of their beliefs, just to help other people feel comfortable, we wouldn't be where we are right now. And Allie, I have a senior at Anderson, and she got a big old dose in the beginning of the pandemic all my children did, of, protecting my oldest, who's immune compromised. And she had to be a lot more careful than most of her friends, and it was really hard. And I know how hard it is. So I just wanted to just say how much I admire you for being brave enough to be vocal and for protecting your family and your community.
Anyone? Well, while we transition into like kind of the resources that's out there, right? So RT, you were talking earlier about like AISD in the beginning of the pandemic, and like all the resources that's available. What support and resources are available for the students and families that, as well as teachers and staff and administrators, like now when there's so much uncertainty, or to the people that don't want to get vaccinated? What type of resources are you providing for the students and the faculty, for and those that don't?
That's a great question. So we're working in an ecosystem. I think that's the best resource, and that's the best way the word I can use to describe the reason that we have been able to provide so much to our community is because of the supportive ecosystem. Our superintendent is in constant contact with Austin Public Health. We're in constant contact with the city council and the commissioner's court and all these people who are trying to serve the same community and get folks vaccinated. So we've just been really fortunate as well with working with our hospital systems and things like that. But so we, by the way, Vax Together, I love you guys. You are so awesome. My kiddo just got boosted on Friday, thanks to Vax Together at Walgreens. So that was awesome. So I think really we have a layered approach in our schools, as you may have heard. We've got the mask, we've got distancing, we've got benches at a lot of our schools, like picnic tables where kids can eat outside, or it's a little bit safer to take your mask down and eat and socialize. We do have we have testing available at all of our campuses. So if a student feels like, they need to get tested, that's available to them. Staff can also get tested, which is great. We have occasional testing hubs. We had a big one on Saturday at the Tony Berger Center. And we also have vaccination clinics all over town. I'll drop the link where you guys can stay updated on that calendar, because because it's always changing, and we're always adding opportunities for people. Some other things that a lot of school districts have done, including AISD, is we offered incentives, like monetary incentives. I want to say it was about $250 or so for staff if they could show proof of getting vaccinated, which I thought was kind of cool. And we have things like a personal leave bank for our staff, so they can kind of donate days to a personal leave bank, so that if staff get COVID or show symptoms and they exceed their number of personal days, they can dip into this bank. But you have to sort of, you've got to donate your days in order to, you've got to be part of the system. So you're giving something up with this chance that you might be able to benefit from it. So it's not perfect, but it's an option. But one thing that this has really taught for me, well, there's a couple things. One is, like, our biggest resource that I mentioned was that ecosystem and the compassion and the sense of community that has come out of this, where we have to talk to each other. There's no reason for us to be duplicating efforts, or, we've got to be super efficient and figure out how we can get the most people vaccinated. You remember what we had the COVID drive-through vaccine clinics over at Circuit of Americas, and that was a great collaboration between so many different entities. And so but I see it in little ways too. I see teachers who are covering each other's classrooms. I see families, people setting up care calendars for families who are struck by COVID. I see, when the pandemic first hit, we had parents who were organizing to get snacks to bus drivers who were parked in various neighborhoods around Austin because they provided Wi-Fi. I don't know if y'all remember that, but it was like the first winter of COVID, and it was cold, and these buses were out there providing free Wi-Fi, and parents brought them hot chocolate and things like that. But also from like a systems level, that compassion sort of shows through when you're thinking about, okay, it's very easy for somebody in one position to say, oh, we should close down schools, like at the first sign of COVID, without remembering that we have many, many thousands of students whose families just don't have that option. Like, they need to send their kids somewhere because either they're like, that kid is going to be unsupervised, or they might be in a setting that's more dangerous than school, with a bunch of other kids at a neighborhood center or something like that. And so what it really showed to me is that we need more resources. We need more infrastructure for early child care. Thank God for the United Way and the work that you guys are doing with Success by Six. We're partnering with you guys on that, but we've got to elevate that conversation. We've got to elevate the conversation around school funding so that we can pay our teachers what they're worth, because they've carried us through this pandemic. And I feel like we've got to just make sure, please, y'all need to vote for people who are making these life and death decisions about our kids. And that's going to make a huge difference. But we are offering a lot, and the main thing I want to make sure I don't forget is I'll put a link up in the chat where you guys can see all the clinics and everything that we're offering to our communities.
I would love to echo just the collaboration and the relationships that have grown. I mean, the pandemic has been awful, clearly, in a lot of ways, but I think there's some really beautiful things that have come out of this necessity. I mean, Vax Together wouldn't exist if it weren't for the unique partnership we have with Walgreens, for example, which was born out of need to bring vaccines to the visually impaired at Austin Lighthouse, and of all of the organizations, and I called everywhere. And Walgreens was the first and only pharmacy to say yes. And as we were there at Lighthouse, on the verge of tears, quite frankly, for the majority of the clinic, all of us, just because it was incredibly beautiful. And it was also heartbreaking that it was the first week of April and the vaccine had been available since December. And they were the visually impaired, the blind there, who were essential workers and were making all of the Purell that we had all been using for all those months, and they had COVID and they had losses, and they were just getting their vaccine so many months later. And it was heartbreaking. And as we stood there, Matt and the regional, and regional leadership. And we were like, I think we could do something with this. And it was just this conversation that was born out of being there and watching the work and how meaningful and impactful it was. And then the relationships that came out of that a few days later, we had worked with District 2's Councilwoman Vanessa Fuentes, and I get an email about a grant opportunity with United Way. And we weren't even an official organization at that point. We were me and a few friends who had found each other and were helping people find vaccines. And we grew an organization out of, the interest in applying for this grant, and United Way took a chance on this brand new organization. And here we are, we're fully funded, we're a nonprofit. And I would say that, our grant manager took all these organizations, some of which are brand new like us and some that had existed, and put us all together and said, you're all recipients of this grant, we're a collaborative and we're going to work together. And the relationships that have now come from this, all of these leaders and people communicating that before the pandemic probably wouldn't have trusted each other to communicate or wouldn't have relied on each other. And now there's this thing happening where instead of any kind of competition, we're just helping each other. So, wow, you got, several thousand boxes of tests from FEMA. Well, we're going to share them. Great. And now we're dropping them off on people's doorsteps, and we're, all giving to each other into our communities, because what we're finding is that people are able to help their communities the most when they're trusted and already deeply rooted, boots on the ground in those communities. So I may not be trusted in certain communities, and that's okay, because I'm going to share my resources with people who I have now know are doing great work, and they're in those communities and they're going to do the same. And this thing is happening, and it's beautiful. And for anyone on our 10 a.m. Call with United Way, with all these other organizations, you see it happening in real time. And I think this is happening all over. And I hope that when we're not in crisis, that this all continues, because I think what we're learning is we do this together. We really do. And it sounds kind of like an overused phrase, but it is so true. And it's powerful.
Actually, Michelle, that'll be a good transition. If Michelle, do you want to share? And I know that you might have to leave soon. So if, kind of transition into some of the stuff that, you're working on, the initiatives that you're working on with United Way, and how we can, as a community, can support that or learn more about it too.
Absolutely. And I want to put a little plug out there, if you all don't mind, but if you go to Connect ATX, it's like our virtual hub where the community can find vaccine resources and support, transportation, food, housing support. This pandemic, has truly had a rippling effect in our communities. But just like Sharon said, in essence, we are stronger together. And I'm so proud of all the work that we've been able to do together, and hope this continues when we get on the other side of this. What I am currently doing is not fully related, if you will, to the vaccine. But I guess I can tie that in, Emily, because Brave Communities and your ambassadors, you guys will be collecting books and also giving out some vaccine information during your book drives. But we recently started a new coalition that is centered around addressing the K through 3rd disparities around literacy. And we're doing that through 4 strategic goals. So engaging caretakers and parents, engaging our community, high dosage tutoring, and supporting those out of school time, like after school time programs. And so we have, well, actually, we will have a birthday here soon, mid-January, it'll be our first year. We have 65 plus organizations. Again, Emlyn is one. And y'all, in 1 year, working in a pandemic, we have, I just want to cry, it's so emotional, but I'm just so proud of all the work that we've done. We've given out 50,000 books to children here in the greater Austin area. And we have some wonderful partners, and each month, now quarterly, we convene around, the goals that I just said to you, and really trying to address those disparities. We know that several children of color especially those children who are in those low income households, they don't have access to books, and books allow us to, just to dream, to see ourselves. We had an event with the 100 Black men here over the summer, and I held up a book that had a little Black girl on the cover, and I said, Carl, who's the president, I said, Carl, this is the first time I think I've really seen a book like this. And I'm 40, don't tell anybody. But we have to address that. We want our children to have the opportunity to learn and read about new cultures, and we want to build that unity and inclusivity, in our children. These are our future leaders, and so just very proud of the work that we're doing. If any of you are interested in learning more, of course, you can go to the United Way website, or you can reach me directly. I'll put my email here in the chat. I would love, Thais, to work with you. I heard you talk about, your organization, and we're just pulling people together, and we're working in the Austin School District. We have 2 schools that we are trying to build programs in. We just supported one of the schools with putting books into their library. They reached out and said, hey, we need some books in our library. They mostly Spanish speaking kids. And so we partnered with Region State to do that for them. And so just slowly, step by step, we're trying to make a wave here in the community. So if you're interested, we would love to have you join us.
Michelle, I'm really excited to interface with you on that. And I also wanted you and Arati and Ali in particular to know that we've been adopting classroom sets of books for teachers to teach. It's rather than moving books directly into kids' hands, we do a little bit of that. But I've reached out, the low-hanging fruit was Crockett was nearby, and I just asked the teachers, what are you trying to teach that you need a classroom set of that you can't afford and do right now? And then we purchase the books, and the community comes in and they sponsor the books, and they put a little nameplate in, and then we take the crate of books over. And so the first one was for the SOAR class, and they needed a classroom set of stamped. And so we did that. And now I'm doing a graphic novel, Persepolis, about an Iranian immigrant girl for another one of the teachers. And of course, we've partnered with the 1619 project as well. But I want to keep doing this because every time I announce it, it takes about 24 hours for the community to swamp me with sponsorships for the book. So, if they're
connect.
Yeah, and specifically for marginalized voices, specifically that. So let's connect on that.
Absolutely.
Well,
It's
been a great joy.
Oh yeah. So my background is in pre-K education, and I did a lot of work with Success by 6, and so this is a new world, if you will, for me. But just seeing the gratitude, on the kids' faces when we're bringing them these books, and it's a feeling I can't even describe. So we want to do that. We want to build our parents. As a matter of fact, we're partners with Families as Partners from AISD, and we're going to be working with their literacy champions to put on community forums like this, to do some parent training. So wherever there's a door open, we want to walk through that. So I put my email in the chat. Please feel free to reach out to me with your thoughts, your ideas. You want to join. Everyone, got to do this together.
I just want to tell you a story real quick before you run. There's so much energy in the world right now just to do anything, anything to make things better. And I have these lovely teens who identify as trans. They come over from Crockett High, and they have not had the resources to, I very carefully tried to represent that community as well in the bookstore. And so there's all these books and they couldn't afford them. And I got on Twitter and talked about it. And I said, hey, if anybody's feeling a little Christmassy, there's some kids here who sure would like to be able to get these books that their parents will not get for them. In fact, they may even have to hide them from them. But, I would ask the kids, are there grownups in your life that would get these for you? And they would, no, there's no, and I woke up the next morning to $1,300 in my Venmo, just from the small little community I'd managed to put together on Twitter. People are energetically wanting to just devote themselves to making the world better. So there's a lot of opportunities out there, folks. look at Vax Together, look at these opportunities to help.
That's great. Thank you, ladies. And Michelle, I know you might have to hop off, so thank you so much. And then again, Michelle's contact information is dropped on the chat board. And while we're talking about the books, Allie, do you mind? So Allie is our this year's cohort of Brave Ambassadors. And so just to give a little background of our ambassador programs, we have a cohort in the summer that we call Brave Makers, and then also a academic year-long cohort called Brave Ambassadors. So Allie was a Brave Maker this past summer, and then she's extended to be a Brave Ambassador. And really it's to equip teen women, young women to be able, and non-binary to be able to build relationships, awareness, voices, and engagement. That's the purpose of Brave, and just to kind of equip them with tools and resources so that they could use their voices. And, we often think that we want to amplify marginalized voices, and young people, we often feel like are marginalized voices, and the society can learn a lot from them. So what we're doing right now is a little book drive. So Allie, I'll turn the mic over to you to kind of share that initiative.
Yes. And with what y'all were saying earlier, this summer, I was a Brave Maker, and I did my kind of final project on, the title was Black History Matters, and getting history of just that we've been deprived of and haven't been, and that's been taken from us in schools through books and textbooks and everything like that. So I was really enjoying hearing y'all's conversation, but this is great because this has to do something with something I'm about to share. So Brave Communities has officially launched the I Am Brave book drive, which is a young people's book drive meant to bring the community together of all ages. Through this book drive, Brave is aiming to educate the community on representation through diverse reading materials, as well as provide health information to the unvaccinated, vulnerable, and vaccine hesitant populations. So you can donate new or lightly used books, and yeah, there's a lot more information as far as deadlines and drop-off locations, because I know there are some people who are participating in this on this call, but for more information, Brave social media platforms has a lot of that information, and it's at Brave Communities on Instagram, Twitter, and Facebook. And there will be a link in the chat if you're interested in donating. And it's a Google form, and you can fill it out and donate books that will be distributed all across the community. So it'll be really exciting, and I am super just excited to see the books that are going to be received and how they'll be distributed, and helping with representation. So I think this is going to be really cool.
Thank you for that. And just to kind of plug in and talk about the book drive a little bit more, it is, we launched it, it's active now through the 23rd. And so we're really trying to culminate and peak it this weekend because it is MLK's birthday weekend, and Monday is the National Service Day for MLK. And so, get out there. We have different drop-off boxes, and we've partnered with a lot of different, partnered with intentional of small local independent bookstores like Thais' and Reverie Books down south. We have Black Pearl Books up north, connected 2,000 villages. We have Book Women, Book People, and then also the St. John Public Library, so that they are drop-off places. But we also encourage you to buy from these stores. And this is like our model that we have at Brave, where we're wanting to empower, educate the community. And then we, as like these conversations, and then also understanding the importance of representation, and that it's so important to have multicultural and multilingual materials, in the classrooms and outside at homes. And even if, you can read English or read Spanish, it's so nice to be able to hear stories and get the different like authors' perspectives and publishers' perspectives. So really go out there and support these, the small independent businesses like Reverie. And then also, it's a great time. It's the new year. Let's all be a little Marie Kondo and clean out your bookshelves. And anytime that you have any like new or gently used, And this is also a great time to kind of do a personal reevaluation. I'm always about like checking in and making sure how intentional you are with your diversity. And so when you clear out your book, see how diverse it is. And so if it's not, then go shopping at Reverie and the Black Pearl books and check out the libraries and be more intentional of your authors and what books you're reading. And so really, and then from there, we're going to be partnering with the different clinics and different, talking to the different communities that are vaccine hesitant. And we have these little book markers in different languages that have the QR codes of where you can get vaccinated. So we'll be distributing that with the books. So, and if you want to help out with there, we're still figuring this out with all the stage 5 and how to do like distributions. It's always nice to be in community in person, but a lot of times it just might be the quick drop off and not too much interaction. So stay tuned for that. But, Matt, I want to just also connect with you because you have so much like I don't know whether it's customer or like you're training your technicians of kind of like, what is there? And I know you're not a medical doctor, so I'm not anticipating, like all the medical, like discoveries of COVID vaccinations, but then can you give, like, I would love to hear your story and like what it, for someone that hasn't been vaccinated or hasn't been boosted or, like is still trying to go through the process. Can you kind of walk us through the process and, kind of what a day in a life of a pharmacist or a immunizer is and walk us through that step.
There, I'm unmuted now. Okay, sorry. There's a lot you need to know about all the different vaccines. As of right now, there's 5 different vaccines on the market that have a lot of different ranges for age and different rules accompanied with their boosters or third doses. My suggestion with that is that if you were 5 or older and your choice is to get vaccinated, is to reach out to your medical professional, right? So it's pretty easy to get into contact with your doctor or a pharmacist and to schedule an appointment. But the questions that always come up, and I could talk for 45 minutes about this, but I don't have time for that, is it's going to be a face-to-face conversation that you have with your medical professional at the moment that you get vaccinated, because there's going to be more questions that you're going to have. So you need to put yourself in that position to have like a real strong conversation about what vaccine you need and your personal needs for that, right? As for like a plan that a patient would need, is my suggestion is you have to set yourself up for success. So if you're working a 9 to 5 Monday through Friday, go to a clinic that's on Friday, because you're probably not going to feel the best during the weekend. So you set yourself up for success. So you're sick during the weekend or you're not feeling the best through that. And then just a little something that a lot of people don't think about, but is a big deal for people like me and organizations like Vax Together with Sharon, is a lot of times people will do this thing where they go and put themselves in 4 or 5 different clinics because they're panicked, or for whatever reason, they have scheduled themselves several different places throughout a week because they wanted to ensure that they got their vaccine. If you do that, that's your choice, but cancel your appointments because it needs to open up a spot for somebody else that's trying to get the vaccine. I really can't stress that more, is if you are in 4 clinics to say during the week and you go to your first one and then the rest of them during the week, you don't cancel those appointments, you're taking away 4 potential vaccines that can go to someone else. And right now it's hard to get a vaccine because all the schedules are booked up, especially right now that we're peaking on Omicron. So that's kind of something that a lot of people don't see. It's kind of like the internal works of a clinic, but it's something that can make a big difference, because once those those positions open, they fill up almost instantaneously for people who just sit there and surf around looking for vaccine opportunities. So.
Thanks for that. And then like, can you share, whether it's you or maybe Sharon, share like what's available, especially for, you know, like I know what a great project that was for the visually impaired. And then, you know, what other resources are available for individuals and families that, you know, have a cultural, with language barriers or cultural differences, like what is available and what type of resources are out there, or how can we, is there an opportunity for us to reach out to that community?
Do you want me to take it, Matt, or do you want to take it?
Sure, jump in.
I can speak for Vax Together that when you register for a Vax Together clinic, it's going to take you through a series of questions. We do use Sign Up Genius. It's an upgraded version, so you're not going to have all the ads. I know people have used it, and it's really frustrating for like PTA things or signing up for things at school, but this is a better version. And one of the questions that we ask is, how did you hear about us? And do you need any accommodations at one of our clinics? And we do read all of those comments. We use those to help make the experience better for our patients that come in. And we use those for things like language or ASL, for example. So if you write to me and say, I need an interpreter at the clinic, please, we're going to have that there for you. So we have a couple of different organizations that we work with, and we'll have sign language. We are we almost always have someone bilingual, English, Spanish. We try very hard to make sure that we do, either Walgreens does for one of the pharmacists or on our team. We work with other organizations to make sure that we have translation. One of our regular team members speaks Arabic. And then we almost always have someone who speaks Spanish as well. We have therapy dogs at a lot of our clinics because families have said that they feel anxious, especially their children, and the therapy dogs seem to help a ton for families with anxiety and fear. So we do that. We also, I brought some little props here. We have little teddy bears and fidget toys. So if you come to a Vax Together clinic, there's going to be baskets of free toys. And these do have our website on them. And so we find I kind of go around, I'm not out and about as much as I was pre-pandemic, but when I am, I do sometimes see kids walking around with our bears and our fidget toys. So we know the message is getting out there. And there's also something I'm crazy excited about. I know I'm totally screen hogging here, but Vax Together became aware of a book. I'll show it here. This is called Vaccines Explained, and the publisher is Language Lizard. And they have, they produce books, and they have a multicultural and language approach. And we have ordered 700 of these books to donate to community organizations. The majority of them are in English and Spanish, but we've also ordered books in Arabic and Vietnamese, and they will be producing them in Burmese soon as well. So we are planning to donate these to your book drive, and we will also be distributing these to schools. Our plan is to try to get these in all of the AISD libraries who are interested in them. And there is a QR towards the back of this book, and it links to teacher resources and lesson plans. And I have permission from the publisher of the book to overlay clear Braille stickers, so that if you're blind or visually impaired, you'll be able to know that there's a QR to get you to the audio book. So we're really excited about these. And you can't really, it's hard to probably see on the screen, but if you just look at some of the illustrations, it's incredibly diverse. They did a really good job. And the language is very simple. It's elementary geared, but I think that it's going to be helpful for a lot of families. This isn't COVID specific. This is just explaining in general how vaccines work and their history and why they're important. And it's really simple. And I think that this is pretty exciting. So I hope that it's Language Lizard is the publisher. And I hope that our putting the Braille stickers on here will encourage other publishers to do something similar, because it's really simple. It's not that expensive. And it just wasn't something they had thought of. And when I asked about it, they were very happy to allow us to modify the books. So I think that maybe we can trend set a little bit. And I hope that in the future, these books will be more accessible.
That's fantastic. Thank you for that. And again, for any audience members, even in the Facebook group, if you have any questions, feel free to drop it into the chat board and then we can have it. And Allie, thank you. I was actually going to ask that. That is her Brave Makers project, is a video. And so if you get a chance to be able to watch that, is wonderful. Thais, I know you're about to sip this thing. I just wanted to I know that you've got some great initiatives at Reverie. Do you want to share that too?
Well, I already talked about sponsoring the books out for teachers in the 1619 project, but I did also want to point out that we do a 2% plus tips give back each month to an area nonprofit. And so if you come and shop at Reverie, we're also donating some of our profits back, and anybody who tips in to it, that helps us build on it, because we're a teeny tiny bookshop. So, but everybody needs to be giving back at least a little. So we'd like to contribute that to Brave Communities this month. And yeah, and it's, I'm sure those bookmarks have printing costs. And do, come in and tell me more about it. And if you know of a candidate for which a little bit of money would go a long way, let us know.
Thank you. This was news to me. This wasn't a plan. This isn't why she's on the panel board. So, but thank you. She's just done this amazing things at Reverie, and it's in South Austin, off of Manchac and Stasny. And RT, do you have any more insights? Or more information that you want to share with the community, whether it's as a parent, as a trustee member, of what things that you recommend that we do individually and collectively to really kind of reduce the education disparities that's growing during COVID?
I appreciate that question. Well, things like this book drive are going to help, if our kids have access to, to materials and to books and, get to continue learning at home. That's wonderful. So thanks for doing that. You're right. Our students are not where they might normally be academically. And on the other hand, a lot of our students have gained a lot. They have learned to advocate for themselves. They've learned how to use technology. It's not all terrible and negative and doomsday. I still remember about 4 or 5 months into the pandemic, I was on a call and a dad said, I actually never knew what my kids were learning in school. And now, because they're online doing virtual learning, he sees what they're doing every day. So there's some, you got to try to find the bright points wherever you can. But I would just say, like I said earlier, vote. Pay attention. Our Texas ranks almost last in per pupil funding for public education, and I cannot just overemphasize how important it is to fund education properly so that we can keep our teachers. We are leaning on them a whole heck of a lot right now, and we owe them big time. And it's really hard to do that, especially in a city like Austin, where it's so expensive to live. So it's because of politics. We almost didn't get $250 million in federal COVID relief in our district. And it's because of our pro-education politicians that we were able to get that money, which is making a huge difference in the lives of our kids. But I would say, besides all the policy and voting kinds of advocacy work, I would say, join your local PTA. Consider being a substitute for the district. You get paid about $125 a day, and you only have to commit 10 days a semester, and it's just a great way to give back to our schools and to our kids at a time we really need it most. Check in on the mental health of your teacher friends and anyone who works in the school system, and your kids and your kids' friends. I put up a link for our mental health services that we offer through the district, and that is a crisis as well. And kids, you know, our communities, you all know this, they are suffering. They have seen things and experienced things that they shouldn't have to. There are lots of opportunities to volunteer in the district, even through a pandemic. And there's an organization called APIE, APIE, and you can just Google that. And you can mentor students who are in high school, and it's just a great way to just you know, support our students at a time that they really need it. And oh, I just want to say one more thing. People don't often talk about special education, but I want to just give you a little insight into how this pandemic has really complicated things. You know, for if a student needs to get diagnosed and evaluated for special education. So typically a parent or a teacher will start the process and be like, hey, my child needs to get evaluated. Well, during the pandemic, we had almost a whole year where we couldn't do a face-to-face evaluation, you know, and we were not allowed to do them online. So like there's a backlog now that could be created. And it's just really, this is a problem everywhere in the country. And so now we're trying to kind of make up for that lost time. So it's just, it's been really pernicious, had a pernicious effect on a lot of our kiddos, but, you know, I'm optimistic about where we're going and how we're moving forward because of the community coming together and really helping.
That's beautiful. Yeah, thank you for that. And there is an audience question that there are a lot of school board trustees coming up for re-election. Is that correct for this upcoming election?
Yeah, I mean, in November, it's still
November.
a while off. But you know, I would say, like, you know, in our surrounding school districts, you know, the politics there are super different. So, I mean, pay attention to what's happening because some of the people who really care about science and safety, like in Round Rock and other school districts around here, I really worry about what's going to happen to their seats because they're going to have a lot of competition. Hopefully that won't happen in Austin, but you just, you know, it's going to be interesting.
Yeah, thanks.
I wanted to, there's a couple of, we can't really like politic, but there are some leaders of some of the grantee organizations now running for some of the public office positions. So I can, there's a lot of leaders that have grown out of the pandemic. So I would just encourage everyone to really do your research. And when you do vote, just take a look at what the people are doing in the community. And if you see boots on the ground, you know that those people are really rooted in the communities that they're serving. And I screen hogged on Matt, but I really wanted Matt to have a chance to talk a little bit more about Walgreens, because I'm assuming other pharmacies have this too. If you do speak a language that isn't Spanish or one of the more common languages, Walgreens does have access to language, and there's a hotline, correct, Matt?
We have solutions for most everything if you just ask. That's the biggest thing, is just come to one of us, and we have pharmacists that speak almost every language. We have a hotline that can connect you with people across the countries that can help you communicate. American Sign Language and every language that you can conceive of, it's available. So if there's a situation where you just need a language you don't even know communicated, we can help you. Just ask us, just reach out to me, reach out to Sharon, and we'll get you connected.
And if you're a student and you have found the pandemic interesting from a career perspective and you're interested in working in pharmacy, Matt is also training pharmacy techs and involved with the programs at ACC. So connect with him for that too. I'm going to do a little plug because I think it's phenomenal. In our early vaccine clinics, Matt was giving students in pharmacy tech at some of the schools we worked at a chance to actually learn about the process and practice. And I just think that having kids, enabling kids to feel like they're part of it all and to be looking at future careers. And from what I understand, you can graduate from high school and go straight to work and make a pretty good living. I'll let Matt talk more. But anyway, so my little plug for just pharmacy as a career. There's a shortage of healthcare professionals. If
you're interested, if you have a student that's interested, get them in touch with me. The sky's the limit, really. A lot of my best managers were once pharmacy techs for me. And you can work your way up through multiple different avenues with Walgreens or any part of the health in a health career somewhere. Doesn't have to necessarily be with Walgreens, but it can start here, and sky's the limit. So if you're interested in pharmacy tech, reach out.
That's great. Matt, do you mind if, is there like when you say reach out to you specifically or to Walgreens, is there a link or an email that you want us to use? Or if you don't have typing capabilities, we can share that later, or if you want to drop it in the chat board.
I can share it. Yes, I'll give it to you.
Okay, perfect. And then, yeah, we've kind of been answering kind of like our last question that we always ask for, like at our Brave community conversations, is like, how do we be brave? And so Artie, thank you for sharing that. And, I actually might transition over to Allie because I know, last fall, Brave Communities, we led a session with the Educators in Solidarity Conference, the Unconference. And Allie presented on students of disabilities. And so do you want to share a little bit about that, and then what it means to be brave for Allie? What does that mean?
Yes, I wanted to talk about this. I am really passionate about this subject because my brother has autism, and just with what, I don't remember who, but someone was talking about how important it is for kids with special education to be able to get tested, and how it is really important to do that in person, because you want kids with special needs to get diagnosed at a very young age so you can start helping them as soon as possible and starting therapies as soon as possible, because I cannot express how important having those resources are, and how unfortunately some people aren't fortunate enough to have those resources, but it can just make a huge change in the special ed kids, just quality of life, ability to learn, ability to navigate social experiences and travel, through the world. So it's just so important to make sure we're raising awareness for that. And at the EIS conference, me and another Brave ambassador in our program both of our brothers are special needs. So it was really great to just talk about that, and how just kind of how you can get rid of your I don't know the word, but just raise awareness and kind of keep an open mind when it comes to special needs, and just have some empathy for it, because it might not seem like a big deal to some people, but when it is affecting your family, it is really important. And especially in the pandemic, it has, it's just, we're learning as we go. So especially in the pandemic, it has really been hard to get him the resources that he needs, my brother, and help him, even just right now, he has gotten COVID, which is crazy, because and it's just crazy to see, because when you tell him something, because of his autism, when you tell him something, he sticks with it, really repeats it, doesn't really go off. So when you tell him, wear his mask, hey, you need to get vaccinated, you're gonna have to get a shot, it's gonna hurt a little bit, but this is what we need to do for you to be able to stay safe. Never takes his mask off at all. So yes, I'm quarantining now as well, because I've been exposed. I've tested negative every day, but we're being careful and taking the correct precautions. But it's just it's sad to see him reacting to this, because that was his worst fear. He knew don't get COVID. So we're kind of working through that right now, and it's all just a learning process, because this is nothing like this has ever really happened. So no, therapist kind of knows how to deal with this. No, we don't know how to deal with this. So yeah, as far as being brave, just educating people about the issue, and then actively doing the work to change the system and hold people accountable. So yeah.
Thank you. And did we hear from everybody about all the panelists from How to Be Brave? Anyone else want to share any last minute thoughts?
I have one, just a little quick little thing. I didn't finish answering one of your questions, and I just wanted to polish that off here. We need to change one little behavior, and we need to change what we keep in our medicine cabinet. And what I mean by that is we need to start having the COVID tests on hand before you think you have COVID. And I don't mean have like breed. I mean have at least 2 for everybody in your family. Sitting in the cabinet, just like you have ibuprofen, just like you have cough medicine or cough drops, or things you just keep on hand because you want to do something preemptive. If you do this, that'll end this run on COVID tests. The market will balance out, and there will be plenty in the store, and there'll be plenty at home at all times. And you can make a better decision based on what you have and what you bring to your doctor when you have questions or you're seeking treatment. So my challenge I would send out is for once you can start seeing them in stock again, but buy up for your family and keep them in the cabinet preemptively. So, thank you.
That's good advice. COVID tests are now the 2022 version of the 2021 toilet paper.
Yes. Yes.
So
I wanted to say that my family had a good experience at the Burger Center. They just opened a mass testing site there where the rapid tests come back within, I think, an hour, and the PCR tests come back within a day. I know that there's a lot of people in our community that, I'm sorry, cannot afford to buy that many COVID tests and put them in their pantry. And I'm very grateful for those people in our community who've made these mass testing sites available. It was a really good experience. Whoever is running that, thank you very much. And it's there for people.
that's great. Any last questions or comments from the panelists? I just want to honor everybody's time. Thank you so much. It's as we wrap up, we do have a little survey that we want to ask. We always want to get people's feedback as we want to improve our programs and services. Next month, we are going to have our community conversations. The date is not set yet, but the topic will be health disparities in the Black community, and COVID. Everything this year is going to be kind of related around COVID, but the health disparities and how it's being increased due to COVID in the Black community. And so it'll probably be the second week. I'm just trying to finalize and confirm dates with some of the panelists. And so again, we have these monthly community conversations, and then our other program is always empowering our youth programs, our ambassadors program. So please support us with the I Am Brave book drive. So it's happening now until the 23rd. And then we're really trying to peak it during MLK weekend this weekend. So spread the word if you want to donate any new or used books. We've got Reverie, Black Pearl Books, Book Woman, Book People, and then St. John's Public Library as drop-off spots. And then we always encourage you to kind of support the businesses too. And then we are going to then be distributing them to the vaccinated, some of the vaccinated clinics, and as well as the vulnerable populations and vaccine hesitant. So if your community wants some books too, just let us know. Follow our social media. That's probably the best resources. We're always sharing different community groups, and then a lot of the vaccine resources. We're still continuing our weekly food distribution. So we do have food distributions that we serve the low income apartments, mainly in the Southeast area. So I know a lot of times people are asking like how to volunteer with Brave. So I think we'll be dropping in like our a little link if you want to volunteer with Brave. We have ways that you can like serve and speak with the ambassadors program, or if you want to like help out on the food distributions, it's usually Wednesday, like midday. So you want to take a little lunch break, you can help out with that. And then also this drive that we're preparing. And if you want to donate the book, we call that volunteers too. And it's a very safe and simple way on MLK Service Day, and then also distributing them. So thank you all so much. Everyone stay safe. And again, I love the words of advice of, voting, making sure that you learn about the candidates, as well as getting your home, your medicine chest stocked with with COVID tests. And also really the other piece is just being intentional of diversity and inclusion, and really to be able to, build a repertoire in your bookshelves and the media that you're watching and reading, and your friends list and who you're talking to, and as diverse as possible. So thank you all so much, and have a great evening.